Cancer survivorship is a journey, and for some people it's a journey that goes reasonably well. They may have a cancer that's fairly simple to treat and straightforward. For others, the treatment is very complicated, and unfortunately for some, the treatment doesn't offer much hope. So cancer survivorship is complex. It can be really, in a sense, doesn't alter your life except for the knowledge you have cancer, but for others, it's obviously a much more serious situation. And if we go back to 1970, 1971, there were about 3 million cancer survivors in this country. What has happened over the next number of years until today is that our ability to diagnose cancer has improved considerably. We find many cancers much earlier, and we're more able to treat cancers than we were even back in the 1970s. So today we have approximately 14 million cancer survivors in this country. And we suspect that as we move forward into the 2020 and beyond, we're probably going to be close to 18 million cancer survivors in that not too distant future. We're dealing with the fact that people do survive cancer, but they also survive the treatments they receive for cancer. So when we talk about what was called chemo brain, which we thought was an aberration, we thought was something unusual, we now know it's real. When we talk about the side effects of treatment of cancer, particularly for young children, we've been very successful in maintaining life for these young cancer patients, but unfortunately the treatments we offer come with debilities, and so do treatments that we offer older folks as well. So we have a lot to learn about the long-term cancer survivorship, what we can do to help those folks, and what we can do to better treat patients so they don't develop these problems in the first place. As we celebrate cancer survivorship, and we celebrate our 14 million cancer survivors today and our many millions more in the decades to come, we need to be able to offer them an understanding of their disease, and we need to be able to offer them treatments which are going to reduce the effects of the disease over the long term. So let's not only acknowledge that we have so many more cancer survivors and we're fortunate and blessed to have them with us, but let's commit that we need to understand the disease, the process, the consequences, to give them not only the hope of recovery from their disease, but their hope of recovery, and to have a full and healthy, adequate lifestyle going forward, that they celebrate not only many more birthdays, but many more better birthdays.